Okay, what I'd like to do now is a 9-month post-op update for the C5-C6 artificial disc that I had placed last September 2020. I've been dealing with a recent lumbar fusion, if you've seen some of my other videos, but I only made some videos after the cervical disc procedure for the few weeks following, and thought it'd be important to do an update as I've had a few questions about it. I would basically describe that procedure as a complete success. I don't even think about it. I don't think that there's an artificial disc in my neck. There's nothing that reminds me of that, minus this tiny little scar that's almost non-existent, so I can't complain about that. The recovery compared to what I'm dealing with now with the lumbar fusion was incredibly easy compared to this. I mean, I think lumbar fusion is one of the harder ones to get through. And I will do another video regarding that tonight or tomorrow, because it's been 4 weeks since I had that surgery. So I've had a couple of surgeries in the last 9 months. It's been a challenging year. But I would totally describe it as 100% success for the cervical C5-C6 insertion. When I look back at it now, I can tell you that the recovery was pretty quick. I would say for about 2 to 3 months after the procedure, there were times where I felt like some of the symptoms, mainly in my neck, going through my arm, bicep, into my hands, I actually felt that things were worse for a while, and I was a little bit concerned. And in some of my other videos for that procedure, I had talked about the possibility of having an ulnar nerve problem, or maybe carpal tunnel in addition to the C5-C6 problem. And slowly over time, and then into the new year, so I would say by February or March 2021, I'd done some other tests. They ruled out ulnar nerve, they ruled out carpal tunnel, and slowly but surely, the other symptoms from the neck procedure really almost resolved completely. And I feel relieved that I don't have any of those other conditions in addition to what was going on in my cervical spine. So really, if you're thinking about doing that type of a procedure, I would say go for it. My experience with it was fantastic. My surgeon had done maybe 25 or 30 of those in his career. He also did my lumbar fusion. Awesome surgeon. And I just feel like it went super well. Probably the hardest part right after the surgery was just the pain in my throat due to being intubated. And then also with the procedure, in order to get it in, they have to shove your esophagus to the side. Everything gets, pushed around. So your throat is sore for a few days, but otherwise you're up and moving. So if you do have that procedure, and I'm trying to keep this in mind for my lumbar fusion, at least for me, some of my symptoms moved around and got worse. I mean, in that November following the September surgery, I was wearing braces on my hands thinking, something was going on. Again, the tests were negative. And I think slowly over time, those nerves just calmed down, but it took several months for it to completely heal. And it's not to say that I don't have maybe some symptoms if I do a lot of typing or something, if I'm sitting in a chair for a long time, but it's so different. So yeah, I think in the big scheme of things, when it comes to back and neck surgeries, I think that one's probably pretty low on the kind of risk scale. I think they're really mastering this. And the Mobi-c disc that I had inserted, I mean, apparently those things are pretty ingenious. I mean, they really do mimic the movement of a normal disc. And again, the bottom line is I don't even feel like it's in there. I just don't think about it. It's just part of my body now. And I hope I get to that same point with the lumbar fusion. So thanks for listening, and I'll provide further updates regarding the lumbar fusion here in a little bit. Thanks.